Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff. Welcome back to Biochemistry on Catalyst University. My name is Kevin Tokoph. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to be continuing on by talking about some of the types of drugs used in cardiac pharmacology, but this video is going to focus more on the ones that are anticoagulant and also anti-platelet. But before we get into that, let's get into some basic physiology right here. So up here is a blood vessel, and of course these little bitty black dots right here are the endothelial cells, so we do know we have gaps between them, and inside here's the lumen of the blood vessel. Now this cell right here is a platelet that of course exists in the blood, and all this stuff right here, it's shown outside of the blood vessel, but in reality it occurs inside the blood vessel. I just put them down here for the sake of space, but all of this is occurring in the blood vessel. Okay? Now, we have what we call immature clotting factors. These immature clotting factors are the vitamin K dependent clotting factors, meaning if you have no vitamin K, these clotting factors will never serve their function. Those are clotting factors 2, 7, 9, and 10. You have to have vitamin K in order to make them mature clotting factors. And so there's an enzyme right here called vitamin K epoxide hydrolase. This uses vitamin K to carboxylate certain amino acids on these 4 proteins. And so instead of being immature clotting factors, they become mature clotting factors, although they are still inactive. Okay, so when they're immature, they don't yet have that carboxyl group added to certain amino acid residues. Once this enzyme acts on them with vitamin K, they become mature, but still inactive. In order to activate these clotting factors, we would need the coagulation cascade to begin. And when these particular proteins become activated, normally we would see a subscript A after these. So we'd see factor 9A, factor 7A, and the A indicates that these enzymes have become activated. I haven't put the A here, but I'm just telling you that these are activated in this pink box. So normally, the pathway is a lot bigger than this, but here, factors 9 and 7, when activated, will activate factor 10, and when activated, factor 10 will activate factor 2, which when activated, factor 2 is called thrombin. Now, thrombin is an enzyme, and it will convert fibrinogen into fibrin. Fibrinogen is a protein normally found in the blood. It's soluble, and without anything else, it will just stay there and won't do anything. However, when thrombin converts fibrinogen into fibrin, fibrin's now insoluble, and it will polymerize with other molecules of fibrin, and that's what forms the clot. Now, normally when you have a clot, there's a way to get rid of it. Any good thing you have to make, there should be a good way to get rid of it. And so the clot is degraded by plasmin. So plasmin is normally going to be in an inactive state. It's called plasminogen. And so there have to be factors in the blood, or as we'll see in a minute, a drug, that can convert plasminogen into plasmin. Once it's been activated to plasmin, it can then bust up this clot and it will just form a bunch of degradation products. But the point is plasmin will bust up this clot. There's also an enzyme right here called antithrombin 3, which in addition to degrading a number of clotting factors, it will mainly degrade thrombin, thus the name antithrombin. Antithrombin 3 normally will not function like this without heparin. So antithrombin 3 needs to be in conjunction with a molecule called heparin. Now that you understand this, let's get into talking about some of these medications. The first is warfarin, also called Coumadin. Warfarin is an inhibitor of this enzyme, vitamin K epoxide hydrolase. Think about that. If you inhibit this enzyme, the clotting factors will never mature. They'll stay immature clotting factors that will never be able to function because they don't have that carboxyl group added onto some of their amino acids. So they'll stay immature. So if we inhibit this enzyme, that should inhibit coagulation. And that's the theory behind this. Warfarin, for that reason, is often called a blood thinner because it prevents clots from occurring by interfering with this enzyme. The second drug is a number of drugs that are basically just different types of heparin. There's unfractionated heparin and there's low molecular weight heparin. And as we said, heparin is necessary to activate antithrombin 3. Antithrombin 3 will degrade many of the clotting factors, including factor 2, which is thrombin. And as we know, thrombin is necessary to convert fibrinogen to fibrin and thus form the clot. So if we put more heparin in the body, there's going to be more activity of antithrombin 3, and there's going to be less thrombin because it's being broken down. And if there's less thrombin, there's less fibrin, and there's less blood clot. So that's the theory behind heparin. The third type of medication is what's called a plasminogen activator, sometimes called tissue plasminogen activator. And there's a number of kinds of this, but basically what it does is it activates plasminogen into plasmin. And as we know, plasmin busts up this clot into degradation products. So if you activate plasminogen to plasmin, it busts up clots. Oftentimes this will be used in someone following a stroke, assuming that they get it in time and assuming that the stroke is not hemorrhagic, it's only ischemic. Number 4 are these drugs called NOACs. NOAC means non-vitamin K antagonist oral anticoagulants. So for obvious reasons, we're just going to call them NOACs. And the origin of this name is that they don't actually inhibit the enzyme right over here that matures the clotting factors by carboxylating them. So it doesn't actually inhibit vitamin K epoxide hydrolase. Instead, it actually inhibits directly one of these two clotting factors, either factor 10 when it's activated, or activated factor 2, also called thrombin. And of course, by inhibiting these two enzymes, factor 10 and factor 2, we get less fibrin and less clot. So you can see there that those would be anticoagulants. All right, for drugs number 5 and 6, we now go and take a look at the platelet. So platelets have an enzyme called cyclooxygenase, or COX. There's cyclooxygenases 1 and 2. And this is an enzyme that converts arachidonic acid into the prostaglandins and the thromboxanes. So prostaglandins and thromboxanes generally are procoagulant, they are pro-inflammatory, and they are pro-platelet adhesion. And so if we want to prevent unnecessary blood clots and prevent unnecessary platelet adhesion, which will then lead to blood clots, then we should inhibit this enzyme COX-1 and COX-2. And aspirin is the drug that does that. Aspirin inhibits COX-1 and COX-2 via suicide or irreversible inhibition, and that leads to less prostaglandins, less thromboxanes produced by the platelet, and less platelet adhesion and aggregation. Okay? So again, if there's less platelet adhesion, then more platelets can't come and aggregate, and you get less blood clots. Platelets become less sticky, basically. There's also another protein on the cell surface of the platelet called the P2Y12 receptor. This is a fancy name for a receptor that basically promotes platelet adhesion and aggregation. So there are certain molecules that can bind to these receptors, and when they bind, they basically allow the platelets to adhere and then to aggregate. And so this drug, which is called Plavix, actually binds to and inhibits this receptor, or blocks the receptor, and prevents platelets from adhering and aggregating. And obviously, as we mentioned, if the platelets adhere and aggregate, that can trigger coagulation. And so by inhibiting platelet adhesion and aggregation, which both of these drugs do by different mechanisms, these drugs also inhibit coagulation, which then inhibits clot formation. So hopefully this video gave you a good understanding of some of the drugs used in cardiac pharmacology that are anticoagulant and antiplatelet. Please make sure to like this video and subscribe to my channel for future videos and notifications. Thank you.